I need to stop you before your next workout. Because there is a very good chance that something you are doing right now, something you have been told is good for you, something you are doing precisely because you want to stay healthy, is quietly destroying the joints you will need for the rest of your life. I am not talking about extreme sports or reckless activity. I am talking about common exercises. Exercises that appear in fitness videos, that well-meaning friends recommend, that you may have been doing for years. Every week in my practice, I see the same pattern. A patient who has been disciplined about their health, who has shown up consistently, who has done the work, and who is now sitting across from me with joint damage that did not have to happen, that accumulated slowly, repetition by repetition, because nobody told them that the rules change after 60. The exercises that build a 25-year-old's body break a 65-year-old's joints. This is not a minor point. It is the difference between a decade of active, independent living and a decade of managing pain and limitation. Today, I am going to tell you exactly which 4 exercises fall into this category, and I am going to give you the precise alternatives that deliver the same strength benefits without the joint destruction. This is not about doing less. This is about doing better. The first exercise I need you to reconsider is the deep squat. For years, the deep squat has been promoted as the gold standard of lower body training. And for a younger body with adequate cartilage, joint fluid, and connective tissue flexibility, that reputation is earned. But here's what happens inside a 60-year-old knee during a deep squat. When the hip drops below parallel, below the level of the knee, the compressive forces on the patellofemoral joint, the interface between the kneecap and the groove it rides in, can reach 7 to 8 times your body weight. For a person weighing 170 pounds, that is over 1,000 pounds of compressive force concentrated on a joint surface that has already experienced decades of use and likely some degree of cartilage thinning. Your menisci, the crescent-shaped shock absorbers inside the knee, become less vascular and more brittle with age. Their capacity to tolerate extreme loading at extreme angles diminishes significantly. There is also a spinal consideration that most people never discuss. As hip mobility naturally decreases with age, achieving a deep squat position requires the pelvis to tuck underneath, what biomechanists call posterior pelvic tilt, or colloquially, a butt wink. This movement forces the lumbar spine into flexion under load. This is a recognized mechanism for disc herniation, and it happens below the level of conscious awareness during the squat. The solution is not to stop squatting. The squat pattern is fundamental to independence and must be maintained. The solution is the chair squat. Place a sturdy chair against a wall behind you. Stand in front of it, feet shoulder width apart, toes slightly outward, hinge at your hips, pushing your pelvis backward, and lower yourself until you make gentle contact with the chair or hover just above it. Drive through your heels to stand. The chair limits your descent to approximately 90 degrees of knee flexion, the range where quadriceps and glute engagement is maximized, and joint compressive forces remain within safe limits. The chair also eliminates the fear of falling backward, which allows you to focus entirely on the quality of the muscular contraction rather than on your balance. This is not a regression. It is a tactical upgrade. You are preserving the functional pattern while eliminating the joint destruction. The second exercise is one that carries enormous cultural prestige, and the prestige makes it harder to have an honest conversation about. Running. Running is not inherently dangerous. For younger adults with adequate bone density, strong connective tissue, and robust cartilage, running provides excellent cardiovascular benefit. But when we examine running through the lens of a 60-year-old musculoskeletal system, the risk-to-benefit calculation changes substantially. Running is, from a physics standpoint, a series of controlled collisions. Every heel strike sends a shock wave traveling upward through the calcaneus, the heel bone, through the shin, into the knee, through the hip, and into the lower back. The impact force generated with each stride is approximately 3 times your body weight. Over a 30-minute run involving thousands of individual foot strikes, that accumulates to an extraordinary volume of repetitive impact on joints that are already managing age-related changes. Your tendons and ligaments, the connective tissues that stabilize these joints, regenerate more slowly after 60 due to reduced collagen synthesis. This makes older runners significantly more susceptible to Achilles tendinopathy, plantar fasciitis, and stress fractures. And the fall risk cannot be ignored. A stumble during a run, entirely possible given the natural age-related reduction in proprioception at the speed and momentum of running, can result in a hip fracture. In older adults, hip fractures carry mortality rates that should give everyone pause. The cardiovascular benefits of running are real. But those same benefits, the same heart rate zones, the same mitochondrial adaptation, the same improvement in cardiovascular efficiency, are fully achievable through brisk walking and stationary cycling without any of this structural cost. Brisk walking on flat terrain provides meaningful cardiovascular conditioning with dramatically reduced impact forces. Stationary cycling eliminates impact entirely. Viridity, your body weight is supported by the saddle, your foot is fixed to the pedal, and the ground reaction forces that damage knees and hips simply do not exist. The goal in both cases is a moderate aerobic intensity, working hard enough the conversation requires some effort, but not so hard that it becomes impossible. Your heart does not know the difference between running and brisk walking when the heart rate is equivalent. Your knees know exactly the difference. The third exercise is one of the most universally recommended movements in fitness, and one that carries specific anatomical hazards for adults over 60 that are rarely discussed. The floor push-up. The primary issue is the wrist. A full floor push-up requires the wrist to sustain approximately 90 degrees of extension while bearing a significant percentage of your body weight. For a wrist with age-related cartilage, changes in the carpal bones, which is extremely common and often asymptomatic until it is loaded, this is a reliable pathway to pain and inflammation. The shoulder presents the second hazard. The rotator cuff, the group of 4 small muscles that stabilize the shoulder joint, accumulates wear over decades. The supraspinatus, which runs beneath the acromion process at the top of the shoulder, is particularly vulnerable to impingement when the shoulder is loaded in certain positions. When the core is simultaneously weakened by sarcopenia, which it almost universally is in adults who have not been specifically training it, the lower back begins to sag during the push-up. This changes the angle of the shoulder joint and dramatically increases impingement risk. The incline push-up eliminates both of these problems through a single mechanical adjustment. By placing your hands on an elevated surface, a kitchen counter, a heavy desk, the back of a stable sofa, you change the physics of the movement entirely. The wrist is no longer forced into extreme extension. The percentage of your body weight being pushed is dramatically reduced, allowing you to maintain perfect form without your core failing and your lower back sagging. Stand facing your chosen surface. Place both palms on the edge slightly wider than shoulder width. Walk your feet backward until your body forms one straight line. Elbows must remain at 45 degrees to your torso, never flaring straight out to the sides. That 45-degree elbow position shifts the mechanical load from the vulnerable shoulder structures onto the stronger pectoral muscles. Lower your chest toward the surface as you breathe in. Press back as you breathe out. Same muscles, same movement pattern, same strength benefit. without the joint destruction. By placing your hands on an elevated surface, a kitchen counter, a heavy desk, the back of a stable sofa, you change the physics of the movement entirely. The wrist is no longer forced into extreme extension. The percentage of your body weight being pushed is dramatically reduced, allowing you to maintain perfect form without your core failing and your lower back sagging. Stand facing your chosen surface. Place both palms on the edge, slightly wider than shoulder width. Walk your feet backward until your body forms one straight line. Elbows must remain at 45 degrees to your torso, never flaring straight out to the sides. That 45-degree elbow position shifts the mechanical load from the vulnerable shoulder structures onto the stronger pectoral muscles. Lower your chest toward the surface as you breathe in. Press back as you breathe out. Same muscles, same movement pattern, same strength benefit, without the joint destruction. The fourth exercise is one that appears regularly in core training programs, and that is for older adults, one of the most reliably harmful movements available, the lying leg raise. The intention behind this exercise is to strengthen the lower abdominal muscles. The anatomical reality of what actually happens is quite different and quite concerning. Your legs are long, heavy levers. To lift both legs simultaneously from a lying position, your body does not primarily recruit the abdominal muscles. It recruits the hip flexors, specifically the iliopsoas, a powerful muscle group that runs from the front of the thigh up through the pelvis and attaches directly to the lumbar vertebrae. In most adults over 60, the hip flexors are already chronically shortened and tight from years of prolonged sitting. When these already tight muscles contract powerfully against the weight of the legs, they pull directly on their attachment points on the lumbar vertebrae. This forward pull causes the pelvis to tilt anteriorly and the lower back to arch off the floor, creating massive shear forces at the most vulnerable segments of the lumbar spine, the L4 to L5 and L5 to S1 junctions. Rather than strengthening the core, this exercise is loading the spine in one of the most dangerous ways possible. And for anyone with a weakened pelvic floor, which is common after 60, the intra-abdominal pressure generated by this movement adds additional risk. The seated march replaces it with complete safety. Sit upright on the edge of a firm chair, spine tall, not touching the backrest, feet flat on the floor. Gently engage your abdominal muscles, draw your navel slightly inward. Now lift one knee slowly, raising the foot several inches off the floor. Hold for 2 to 3 seconds. Lower with control. Switch sides. This movement shortens the lever arm to almost zero, eliminating the spinal shear entirely. The core must engage to stabilize the torso against the movement of the lifting leg, which is exactly what functional core training should demand. The hip flexors are still involved, but at a fraction of the load without the dangerous pull on the lumbar spine. Perform 8 to 12 repetitions on each side. Progress by adding a brief hold at the top or by slightly increasing the height of the lift. 4 exercises, 4 alternatives. Deep squats become chair squats, preserving the fundamental independence movement while protecting the knee from forces it cannot safely sustain. Running becomes brisk walking or stationary cycling, maintaining cardiovascular health without subjecting aging connective tissue to thousands of repetitive impacts. Floor push-ups become incline push-ups, building the same upper body and core strength while respecting the limitations of the aging wrist and shoulder joint. Lying leg raises become seated marches, training the core functionally and safely without loading the lumbar spine in one of the most dangerous patterns available. Exercising after 60 is not about proving that time has not passed. It is about applying the knowledge that time provides, about understanding how your body has changed and making choices that keep you strong, capable, and pain-free for the decades ahead. The patients in my practice who move best at 75 and 80 are not the ones who trained hardest. They are the ones who trained smartest. You have the information now. Use it